Thank you all for coming today. We're here to celebrate the 10th anniversary of the Institute for Public Health and Medicine at Northwestern. Let's first of all acknowledge that. How many of you here today are seeing people for the first time in person since like 2019? Isn't that amazing how that's still happening? I'm glad that this event can cause that to happen. It's nice to see people in face-to-face for the first time. Really what I'm going to try to do today is talk about really amazing things that I think have happened since we've had an Institute for Public Health and Medicine on this campus. I'm going to spend most of the time talking about the last 10 years. I can't talk about every person and every event and every program and every research project. But when I talk about IPHAM and when I talk about things that have happened here in the past 10 years, it's really not about a place called the Institute for Public Health and Medicine. It's not about a person. It's not about a few people. It's really about the collective efforts of almost 500 faculty, hundreds of staff, distributed across 51 departments and 6 schools, as well as a tremendous number of stakeholders that engage with us daily in efforts to try to elevate the visibility and the impact of public health and public health science from a medical school of all places. And I think that's truly exceptional. So when I talk about IPHAM, I'm talking about all of us and all of those things. And I want to spend some time recognizing people, recognizing some of the programs and giving you examples of how the Institute has tried to contribute to the elevation of public health and public health science here. And I hope by the end you'll agree with me that our institution and possibly the region is better because we have invested in this thing and contributed to this thing we call the Institute for Public Health and Medicine. To begin, I want to briefly just talk a little bit about public health at Northwestern because it didn't begin 10 years ago. Seeds of public health have been alive on our campus for more than 160 years since our medical school was established. Many of you may not know that the Chicago Board of Health, which had some starts and stops early in the days of Chicago through the 1830s to 1850s, was reestablished in 1867. And continuously from 1867 until 1889, the commissioner of the board and then the Department of Public Health was a faculty member at Northwestern. So leadership in public health at a city level began with input from people here on our campus. For 50 years, our medical school was actually located with its principal teaching hospital just about 3 blocks to 4 blocks north of the current location of Mercy Hospital Medical Center on South Dearborn Avenue. And it wasn't until the 1920s that we found our way to the current campus, which on the right there, so the left picture is our medical school next to Mercy Hospital, and the right is the groundbreaking on the current campus in a kind of mud field, which was really a backfilled swamp on the lake before anything was established here. And it was a gift to Northwestern University and Northwestern University's interest in building a campus with 3 schools in the Chicago area that led Northwestern to move north of the river and into this region at a time not the community it is today. I think it's important to recognize that throughout our history, Northwestern's, the School of Medicine, has had departments called things like public hygiene, social service. The Department of what now is called preventive medicine was established as the Department of Community Health and Preventive Medicine, and finally medical social sciences. Those are disciplines of public health, and they have been alive and well for the entire history of our campus. In 1957, it was faculty from this medical school that collaborated with the Erie Neighborhood House to provide free care to residents of the west side of Chicago, which would become Erie Family Health. And it was really kind of, I think, haphazard to some extent at first, not really a program, but the medical school honored its first master's in public health degree recipient really in about 1974. So we've been training people in public health for some time. In 1995, we joined other schools to support an Institute for Health Services and Policy Research, and in 2007 established the first community-engaged research center as part of an effort to build infrastructure for what was called Clinical and Translational Sciences, now the NewCats Institute. So public health has been in our DNA long before 2012, but now I'd like to focus on the more recent history. In 2012, we got this guy, a new dean, Dr. Eric Nielsen, arrived on campus. And we weren't sure what his interests would be. He's a nephrologist with deep interests in bench and clinical science. But one of the first things he said is, we are beginning a new era. And with the Institute of Public Health and Medicine, I think we have created a new environment out of many accomplished environments. IPHAM will forever be an important part of our research enterprise, and generations of trainees and hopefully American medicine will benefit greatly from the discoveries we make. So he recognized the importance of pulling together things that were already here and being purposeful and thoughtful about how to move forward in a way that allows those things to grow and allows us to become a different type of medical school that has impact beyond just traditional discoveries in a lab. We looked back through the original sort of documents of when IPHAM was established. There was lots written, and Dr. Bing Chang is in the crowd here. He remembers this, as well as several others who might have been present at the time. But we tried to think through, how do you sort of begin to fly a plane that's in flight already? How do you build the plane as it's flying? And there were kind of 6 areas that we identified that emerged from some of those early strategic documents. And I'll talk about each of these briefly, but research collaboration, what we call infrastructure development, which is the plumbing and the wiring and the sort of administrative efforts to pull things together. Elevating community impact to be central to what we do at the medical school. Connecting people around issues and topics of public health and public health science, recruiting new faculty and faculty leaders to our campus to continue to contribute and to extend to other areas of public health and public health science. And then finally, organizing and increasing our investment in education and training in these areas. Dr. Bing Chang here with the establishment of IPHAM in 2012 said, the establishment of IPHAM will help Feinberg grow its computational or dry lab research enterprise by stimulating more interdisciplinary research, eventually involving all clinical departments, and by attracting new talent to add to the number of dry lab researchers. It's a name we use here, right? It's not in the wet lab. It's everything sort of beyond the clinical trial. We call that dry lab. The Institute will distinguish Feinberg as one of the few medical schools which has public health as a substantial part of its ongoing research and educational activities. Sometimes it's assumed that an academic campus has in its mission public health. But that's not always the case for a medical school. And Bing is right, that most medical schools do not, they imagine that they're contributing to the health of the public by discovering new treatments or new ways of curing disease or preventing it. But the commitment oftentimes is to improve medical care delivery, which is often one person at a time. It's not really, by its nature, something that's public health or outwardly focused on communities and on policy. So for a medical school to take this on is quite unique, actually. And there are other medical schools that do this, but I think it is something that has continued to differentiate us as we continue to focus on this thing we call IPHAM. I want to talk a little bit about this first area, and really, it's if we're trying to foster collaboration, it's about bringing together the people and groups that are here, or maybe in the community or in other parts of our broader network who aren't already connecting or don't come out of their departmental silos or don't combine interests into something that might grow to be something bigger. So in addition to just developing partnerships at a very small scale, strategically the Institute wanted to really focus on larger scale, like the building of new networks that would perhaps give birth to many projects or many activities, either in the area of research or training. I'll give you a few examples, and one is Accelerate, which is a training program for physician scientists where half come from or see patients at Northwestern Medicine, which is one of our largest affiliate hospitals here, and the others come from other systems in the Chicago area. Accelerate was was basically imagined and was developed by numerous people across the Institute, spanning multiple departments, as well as a number of stakeholders within both clinical and community settings. Accelerate was an exciting contribution, really, I think for the first time that we wrote a grant really together outside of even a center. And it's really, I think, elevated training and early career development for many of these folks. And here's 9 of the scholars here. And just to give you an idea, like Nisha Mohindra on the bottom here is a medical oncologist. And, she, recognized that she sees cancer patients. And patients who have cancer or other complex chronic conditions like kidney disease often see multiple doctors in multiple places over time. And, the doctors are all focusing on numbers and different things and sort of giving goals to the patient and deciding treatment. And really there was an interest among folks in medical social sciences, including, Nisha, that really was about, like, how do we capture the preferences and interests of the patient in what their goals for treatment are and health and well-being, and how do we create even a dashboard for that and organize our care delivery and the visits to different doctors around a shared set of goals that the patient defines. Nisha was particularly interested as COVID hit in how does that happen when you're calling a patient on the phone, and just the logistics of even seeing a dashboard or having the ability to interact with a set of goals that physicians share is really difficult. So her project was about how to actually put that into practice, and will it work, and does it improve health? Another example is Julie Konchak in the middle. Julie's a preventive medicine physician who sees patients at County. And her interests are really around substance use disorder. And she developed a partnership where the system of care was actually community corrections. And she's worked with corrections officers to implement substance abuse disorder screening and referral to treatment in really sort of chaotic, community corrections settings, and using learning health principles to change those systems and to evaluate and study it. So they're good examples of how we train physicians to be a different type of physician, focused outwardly in a patient-centered way, in a culturally salient way, and thinking about systems and environment instead of just individual patient visits. Another thing I'll bring up is some programmatic grants, and these are things that are like, again, they're efforts to sort of go and get a center grant, or we call these P's and U's, and these are large grants that fund a series of activities in different areas. Our Center for Applied Health on Health Research on Aging wrote a grant called a Pepper Center, and these are like really visible signature centers funded by the National Institutes of Health around aging populations. And it brought together the strengths on our campus of everything from, how do we develop systems of care for people that have multiple chronic conditions and see multiple doctors. So part of it, again, is organizing care better. Part of it is if people are older adults with perhaps cognitive impairment or low literacy issues or limited English proficiency, how do we develop educational tools and supports that are really tailored to those sorts of populations so that they understand and can navigate health systems? So there was a lot of components to that, and it also intersects with geriatric care, and there's a community engagement component. So, that's a great example. The center now actually it has many training grants, it has project grants, and it can compete for other research opportunities funded by federal agencies around aging populations. The Chicago Center for Diabetes Translation Research is a Chicago-wide center focused on health services, outcomes, and population health research, particularly that focuses on health disparities or in trying to achieve health equity for populations that either are at risk for or have or experience diabetes. It is co-led by principal investigators, and every core and every component has two directors, one here and one at the University of Chicago. So we've, beyond just Northwestern, we've worked to bring together expertise throughout the city to lead an initiative like this. It's better to do things this way when the NIH only funds 7 of these in the whole country. So we're not going to have 2 in Chicago. So better than compete, we combined forces and have engaged with community partners in the city health department and others to try to elevate the work and the community impact that a center like this can have. And then NU Go Kidney is an interesting example that it's really a grant about developing and discovering new therapies and preventive strategies for kidney diseases. And grants like this, there's many like them, but the federal government not only wants to see, how do we discover new therapies, but how do we apply them in practice and in communities in salient ways that are practical and sustainable. So when this grant was coming together, we didn't have it here because the people who know about discovery research aren't talking to the folks who do work in the community around prevention and translation into clinical practices in other places. So what happened here is our Center for Translational Metabolism and Health came to the table to lead a core or a piece of this program that focuses on prevention and translation into clinical and community settings. And it's bringing in principles of community engagement. So I'm giving you an example of these are scale effect infrastructure initiatives that add to our campus in ways that weren't possible when we weren't connecting from department to department and school to school. Capricorn initially was established. Capricorn, it's a Chicago patient-centered outcomes research network. We don't have an information sharing, like a real-time health information sharing network in the city of Chicago like there are in some other cities. But this was an initiative where people who are interested in studying how community residents in Chicago navigate through different health systems and see doctors throughout the city. They end up in an ER one place and see a specialist somewhere else. How do we coordinate all that together? How do we understand the care they're receiving? One would need to actually bring together data and perspectives from all of those systems together. So Capricorn envisioned bringing those people to the table, and it also included a patient and stakeholder advisory committee, which is citywide, to identify the types of questions that are relevant to the city's health, and to bring together data sources for almost 13 million people across, currently this is, I think as of 2020, 32 hospitals contributing to Capricorn's data network, including 5 children's hospitals, 20 federally qualified health centers, community health center sites, 392 primary care, and 733 outpatient specialty or surgical clinics. Huge network. Initially, the grant and the funding had the administration of the network at Chicago Community Trust, but the growth in research and the ability to kind of birth research and to bring it up and align it with the community's perspectives and what the mutual interests of this network were required, I think, over time a little more. The Community Trust, was sort of at a place where they didn't really feel like they were in the right position to coordinate it. And the citywide network said, who can lead this? And they identified AbleCo and Northwestern as the place they elected to take over to administer the network. So I think for the last 6 or 7 years now, the administration of a lot of the Capricorn activities flow here through the Center for Health Information Partnerships and are supported by our institute. A great example of collaboration and infrastructure development. As we sort of add up the totality, I think it's important to think like you have these scale effects on research and you say, well, let's look at what IFAM members, and the IFAM member base has not increased dramatically. There have been some that have left, some that have come in. We've got, it's probably increased by 10 or 15% since 2012. So there are some new people here, but if we add up the total research awards by IFAM members, this is one of the things that the Dean's Office and School looks at. In 2012, it was $81 million. This is like extramural grants coming from federal agencies and organizations outside of campus. Today, that number is $213 million. So not only has research grown, and it's not just to the benefit of like buildings or staff or infrastructure on this campus. Those research activities, as I just described, are happening in clinical settings and in environments that are way beyond where we're sitting here today in a way that wasn't possible in 2012. In the last 5 years, those members, the total sum of research in the last 5 years is total $872 million. So it's a huge, almost $1 billion in investment flowing through the administrative enterprise here at Feinberg School of Medicine and going out to public health science that we hope increasingly is focused on the needs of the Chicago community and the global community for that matter. So I want to talk a little more about infrastructure from the standpoint of the plumbing and wiring. When we, sort of early on, people thought, well, IFAM is those 5 or 6 people and they have a research administration and, if you put your grants through one of those people and they help support your research, you're an IFAM. That's not at all the case, but we do have an administrative infrastructure and it's there to fill sort of the spaces in between, if you're trying to assemble a grant that is about multiple departments or multiple schools, sometimes it's challenging to do that using a departmental research administration that sort of focuses on its own faculty. But we don't, our members use any resource that could benefit and makes the most sense for them. We don't require people to use the infrastructure we build, but we've contributed to space, to different forms of administrative support, and the development of new centers, which are places where people come together, or sometimes just virtual sort of centers where maybe there's not a single physical office location for those places, but we're organizing ways that people can interact in new ways. People that share common partnerships and interests and funding sources or study similar populations. So to talk about research space, IFAM centers, we can't even add it up because some of the centers actually are administered out of departmental offices here. But IFAM has renovated over 50,000 square feet of research space specifically and strategically to create new opportunities for center growth and collaboration on our campus. That's a lot of square feet. Our administrative support, I talked about research administration, and not all of the 500 members use our research administration. So the numbers I showed before are total research volume. But our research administration, which is there to use if anybody needs it, has supported 708 proposals valued at $739 million in the last 5 years. And they actively are managing $152 million in research awards today. So huge activity that wasn't there prior to 2012. The administrative resources, we have a very lean team. It's only, what do we have, 8 research administrators and probably about 5 other central staff, 4 or 5, that do all of these activities. And not only do these do these activities, but some of the largest accomplishments, in infrastructure that, IFAM helps, support the development of something like a Center for Health Information Partnerships And a few years later, the school decides that it's important to have an institute for augmented intelligence. We had a really robust, strong Center for Global Health that we, helped to support through the early development of IPHAM. And that center grew to an institute for global health. And as those things happen, a lot of the administrative support for even those other institutes, some of that continues to be supported in large part by our IPHAM administrative support resources. So there's a lot going on here by a handful of people that's really quite amazing. And we had to put it in place. It's sort of mundane, I think, to talk about, but it's really important as an engine. IPHAM started with 9 centers. I list them up there. We had an aging center, the community health. We developed a center for education and health sciences to organize all of our public health training and some other master's programs in health sciences into one place. I'll talk a little bit about that. That was there from the beginning. Engineering and health, global health, a center on healthcare studies, population health sciences, and patient-centered outcomes, which were strengths in 2012 when we assembled, but areas for further growth. We now have 16 centers, and our goal as an institute is not to have more centers. It's not at all, even if it seems that way sometimes. But the reason we've added centers, there's a couple that, I think there's different motivations to add centers. I think one of them is if there's a fertile area where we think that if we make an institutional investment early, that it's a good chance that a center will become self-sustaining, right? We didn't have disease-specific centers in the beginning or condition-specific or they were lumpy things like community health and things like that. But we added a center for applied health research on aging, partly because it helped to organize things in advance of applying for larger grants that would allow something like the Pepper Center to come here. We also have a center for food allergy and asthma research. We don't have other centers around particular health conditions per se, but there's a lot of interest in the community in having a center in the Midwest, an internationally recognized center for food allergy and asthma research. By making an institutional investment and developing the leadership and supporting the leadership of that new center, Ruchi Gupta and her team, it's allowed there to be large jumps in further funding and other interests. And so there's sort of signature catalytic centers. There's also the need for additional infrastructure that maybe we just didn't have the critical capacity to have a center. But we went out and we found additional people. We brought together resources in new ways, and we established new centers. An important part of what we do. I want to talk about community impact a bit, and it's really, I think of IPHAM and I think community engagement and the principles of community engagement are really important to much of what we do in the Institute and many of the centers. It's an important part of many of the centers. I talked about a big grant project before in Go Kidney that wanted to make it a core. The Pepper Center has a core on community engagement. Our CDTR has a core on community engagement. Matt O'Brien in the crowd here co-directs it. And it's an important part of all we do, but we need a place to organize it, a place to champion it, a place to stimulate it, a place to push us to new boundaries, a place to fundamentally sort of also not just focus on what's happening on this campus, but the capacity of our community partners. What are we asking of them? What is genuine community engagement that's mutually beneficial? And that's really what the goal is and what a lot of the resources do and are intended to do anyway in the Center for Community Health. So, the Center for Community Health is, I think, our main hub at Northwestern for supporting the conduct and the principles of community engaged research. It's driven by principles of engagement. These principles were developed by partners and by both academic and community partners coming together within the center in a respectful and organized way. And it defines these 5 principles which drive everything that the center does, and that when they award seed grants or other ways to stimulate community engaged research, and it might involve people who don't really spend their time in the Center for Community Health, they're from other parts of our campus, the expectation is that those partnerships are built with these principles. And the Institute for Public Health and Medicine adopts these principles and supports these principles, as does NewCats, the NewCats Institute here on campus. And I think that's important. The center is having a scale effect on multiple other centers and institutes and activities. One of the most important programs, in my mind, in the Center for Community Health is the Alliance for Research in Chicagoland Communities. It's really a special thing. ARC has, I think, one of the strongest and longest lasting examples of a community academic steering committee where there's a shared governance structure for making decisions about who gets seed grants, how to sort of advocate for these principles across campuses, upward communication with other leaders on campus, advocating for a greater community presence and greater input and engagement of community, like genuine engagement of community partners in the leadership here at the highest of levels. And, ARC has been really at the forefront of that. And I just, take in this slide, ARC in, its last many years has engaged with 300 faculty from 15 departments who really came to the center seeking to work more effectively and equitably with community partners. ARC has awarded, and they have this beautiful seed grant review mechanism where all of the grants are actually reviewed by community engaged researchers who might be like faculty or really sort of expert staff, as well as community partners. All the grants are reviewed and decided jointly. $1.4 million in seed grants over the last 13 years or so to 100 plus community partners that funded community academic partnerships. And we did ARC has done an ROI on this of other grants, and those grants could be grants going to the community organization or grants coming here. And in its totality, those seed funds of $1.4 million have generated $24 million in other sources of funding to advance efforts around these partnerships or stemming from these partnerships. There's been scholarship in the way of publications. I want to say that the COVID-19 response at a time where really fundamentally, our community partner organizations were, as service organizations, not even around necessarily research, but how do we evaluate and respond to this sudden community, an abrupt community need that's really straining the community systems, the public health system, particularly in vulnerable communities. The center awarded $140,000 in response and recovery grants to 28 organizations. Today, they maintain active coordination or communication or engagement with as many as about 500 community organizations that have, over this period, either had a seed grant or sat on the steering committee or are just engaged as partners and supported by the center. It's really a unique enterprise. As I talk about this, I want to say a special few words about really a true trailblazer here at Northwestern. And for those of you who don't know, in the middle on the top picture is Dr. Virginia Bishop, or Ginny Bishop. She really was a trailblazer, as I said, in advocating for equity, diversity, and genuine community engagement on our campus. We lost Ginny in February of 2020, way too young at the age of 60. Ginny did many things in the Institute, but one of the things she did that was important here with respect to ARC and the Center for Community Health was to establish and be part of the co-founding of ARC. And she served as its co-director from 2007 to 2010 before taking on other activities here in our program at Public Health and other parts of our campus. It's important that I just say that in 2020, ARC renamed the Community Engaged Research Partnership Award, which it gives out annually to honor the leadership and partnerships. It renamed it in honor of Dr. Bishop. The award's now named ARC Dr. Virginia Bishop Community Academic Research Partnership Award. And it recognizes exemplary partnerships that use a community engaged research approach to impact the health of their community. In 2022, the program in public health will award 2 full scholarships to students who identify as being part of populations or social groups underrepresented in medicine. And this is to honor Ginny's legacy, which continues to last. These 2 sort of logos here are demonstrating some of, just to give an example, Ginny partnered with Sharita Morrison, and who leads organization Demoiselles de Femme in Roseland, Southside community, to develop a partnership for a better Roseland. And the Partnership for a Better Roseland really focuses on trying to sort of organize and connect and coordinate the efforts of community and faith-based organizations in the region to improve the health, safety, and wellness of youth in Roseland, which I think is still continues to be a lasting commitment today. And another example is Building Bridges, which was a partnership that Ginny took on with Apostolic Faith Church in the Bronzeville community, and the effort there was to try to demonstrate how faith communities can play a larger role in addressing public health in the community at large. So Ginny truly was a trailblazer, and I would be remiss to not recognize her in the history of IPHAM's 10 years. So, at a school level, these things like the Alliance for Research and the Center for Community Health and other activities that are happening in other parts of campus that include the program in public health with a lot of embedded learning and both culminating experiences and applied practice experiences that embed student learners in community settings, ideally for bidirectional benefit. The Center for Health Equity Transformation, there are activities represented here that are sponsored by our hospital systems. The school recognized the importance of trying to kind of communicate with one another on all of this, because we're going out and it's great, we want to engage in genuine ways with community partners, but sometimes we're approaching the same partner organizations and they think we're coordinating our message and we don't even know the Cancer Center and NewCats and the program in public health. So the dean's office said, and this partly also came out, the interestness I think deepened at the time of 2020, where the school sort of really tried to evaluate its own commitment to social justice, and it wrote something called the Social Justice Report. One of the pillars of that and the key recommendations was around how to deepen our commitment to community engagement. And so we assemble now all of those groups on a monthly basis to convene and talk about and explore opportunities where we can work in a more coordinated way with our community partners and adopt common principles of community engagement like the ones I showed earlier out of the Center for Community Health. This continues to be a work in progress, but I think it's a good example of how community engagement through the help and work of IPHAM, IPHAM facilitates all of these meetings and continues to try to organize and push forward the Community Engagement Council. So I think it's another good example of our commitment to community impact. We also sought out early to increase awareness and stimulate dialogue. And these things sound like maybe they're just small things, but we hold an IFEM Seminar. It's weekly on Thursdays and for most of the year. And, the goal is to try to kind of bring together and have presenters come and talk about areas of public health and public health science. We've had stakeholder presenters, we've had folks from different campuses, different schools, and they bring different perspectives. And I think it elevates and improves our understanding for the structural and social conditions that shape behavior and health. It also serves to spread knowledge about what are some examples of health promoting interventions that are delivered at multiple levels that could impact population health and elevate public health. And again, engaging with community partners and stakeholders, so we focus on that. And it's a venue for idea sharing, but also discourse and debate sometimes, and it pushes us. So, in the last, just since 2020, the last couple of years, we have hosted 76 seminars with 4,500 attendees, some of whom are represented on the slide here. Ezike Ngozi and Michael Marmot. There's just, it's really quite if you haven't attended it before, tune in to the bulletin and how we we'll let you know who they are, and feel free to drop in a la carte on things you're interested in. But it's a very great seminar opportunity to hear new ideas and share your thoughts. The IFAM Bulletin, which goes out weekly, in the last 10 years we've really published 505 bulletins to 4,300 active subscribers to the bulletin. So it reaches a large audience. Communication is vast. And then this meeting, before the COVID pandemic, we were trying to do this annually. So we've had four forums that have featured keynote presenters. One was Dr. Allison Arwadi here. She gave a special session on the Healthy Chicago. We've got Sandro Galeo, who's Dean of the School of Public Health at BU, and Ana Diaz-Rue, Dean of the School of Public Health at Drexel. And today, if you're able, please stick around at noon to hear the keynote by Dr. John Rich, a MacArthur Fellow, an esteemed leader in health equity on a national level, is now director of the Rush BMO Harris Institute for Health Equity. And he'll talk about healing and justice through the lens of racial trauma and health equity. It's a great venue. It brings people together, and I hope you enjoy it today. We also disseminate knowledge and connect in a variety of ways through social media and other networks to try to spread scholarship and news. And, over the last 10 years, 1,600 just scientific papers published in different outlets have been picked up in altmetrics. If you don't know what this is, it's things that are like kind of non-traditional sort of citation. And 59,000 news stories, 420,000 or 421,000 tweets, and 2,500 policy documents. So, it's big impact, it's big spread, and we're sort of fueling that engine from a knowledge sharing perspective. We went out and we tried to recruit new faculty, and by collaborating with IFAM, a department chair who's in urology or neurology or something might not immediately think, hey, I'm going to hire 2 faculty this year, and they're going to be public health scientists. It's only at the intersection of an institute like IFAM where the department chair might imagine where this person would come and sit and who they'd collaborate with in this thing called public health science or whatever area it is. And so we've collaborated in a multitude of ways with different departments to bring new faculty to our campus. We tally them, more than 45 faculty members brought to our campus where IFAM led the search, contributed to the search, collaborated in supporting the startup or development of these individuals or programs. Some of them are depicted here. We're very proud. It now represents probably almost 10% of our member base, our faculty that came in part as we sort of were building the Institute. And these folks have brought new areas of interest and new ideas, and they're working in a variety of different ways through our 16 centers. We've also supported faculty leadership, and after, as I said before, starting with 9 centers, we now have 16. So when people come in, we don't want them to just lead. We want them to lead, with support and feel, that they're capable. And also, there's an arc of like strategy of how you make your leadership. You can be an effective leader in a lot of ways, but leading in a medical school and leading at Feinberg, there's some things you might need help with. I know I do. So we try to support our leadership in ways. And, one of the things that kind of came out of several activities in 2021 and then stemming over to our February 2022 5-year school-wide research retreat was this importance of creating some sort of a increased focus on implementation and dissemination science. We led the development of a national search and led a national search which led us to recruit Dr. Sarah Becker, a national leader in implementation science, to our campus. We threw her in the boiling water when she got here because when everybody wants something, it's sort of, you arrive and it's like drinking from the fire hose. So we've been, like we've done with many of the new centers, supported a strategic planning event and trying to help with sort of prioritizing how you build that center into something that not only meets expectations of hundreds of faculty, but actually is something truly unique at Northwestern that is the right center for somebody like Sarah with the strengths that she has and interests of the greater Chicago community. Education and training. So as I said before, we had trained some MPH students as distantly as, the 1970s. There were some sporadic master's degrees issued in the 80s and 90s. And then there was an initiative to try to organize all that. So we've had a Council on Education and Public Health accredited MPH program since 2000. And that was here before 2012, but it was disparate and administered differently than some of our other health science education training programs. By organizing those things together in a center, we've been able to sort of elevate and grow some of these programs to be larger, and we've also built new ones. Our Master Public Health program enrollment has doubled since prior to the pandemic in like 2018 or so. So these programs are large and growing and really an important part of the development of and the mission of the Institute. You can see here that we support in IFAM and through the Center for Education 5 master's programs and a PhD program. It's an integrated health sciences PhD that has a few different concentration areas it supports. Enrollment currently 139 in our MPH program, 25. You can read the numbers. We've got 41 PhD trainees. The Master of Arts in Medical Humanities and Bioethics is administered in our Center for Bioethics and Medical Humanities. But collectively in IFAM, all of these programs. And, in the last 10 years, the Institute and these programs have awarded 322 Master in Public Health degrees. 115 of those are to MD, MPH dual degrees. So we're not just training public health practitioners, but a different type of physician who goes out and leads with a perspective of public and population health in new ways. IFAM supports many forms of mentored research training. And so I want to highlight a few things here. Just in the past year, 49 master's students, 41 PhD students, 46 medical students have worked on research with IFAM faculty members. This is actively happening as we speak. 100 students from 16 Chicago public schools participated in something called the CPS Student Health Leaders Program, which is administered in partnership with our Center for Food Allergy and Asthma Research. We also, in the last 10 years, have supported the postdoctoral training of 37 physician and PhD scientists who became scholars in health services, learning health system, and disability employment and disability policy areas. In the last year, 31 junior faculty with appointments at Feinberg and members of IFAM are sponsored by K Awards. K Awards are federally funded training grants for for junior faculty. And that's a big number, so that requires mentored research training. And then since 2019, 27 trainees have participated in the Northwestern University Minority Health and Health Disparities Research Training Program, which is really an amazing program led by Dr. Melissa Simon in our Center for Health Education, Health Equity Transformation. It focuses across the career spectrum, I think from undergraduate all the way up to people that are at the professional stage, and trying to really elevate and deepen our commitment to training the next generation of public health scientists who work on issues of health equity. So we have an important commitment there. And, I'm going to say a few things. I want to say with respect to, I'm going to be brief because, we're running out of time here, but I wanted to say that truly, as a physician, somebody who sort of finished clinical training, and I wanted to, be a physician leader that focused on more than just seeing one patient at a time. I thought health had more to do than what I could accomplish in an exam room. And I was trained well as a physician, but I went and did a fellowship at the University of Washington from 2001 to 2003, where I would have the wonderful opportunity to get leadership training and to learn how to conduct research on systems and environment and behavior in ways that's rigorous, in ways you could publish, in ways as somebody who might aspire to being an academic or working at a university, I might get promoted doing it, right? So I needed the skills, and I went there and they said, hey, as part of this, you get a master's degree. Do you want to do a Master of Science or do you want to do an MPH? And I had no idea. I talked to a few people and they said, well, the MPH, you do this practicum where you do some of the work out with a community agency, and your thesis might focus more on things outside of like a doctor's office or around like an epidemiologic analysis. It might focus, you'll have to do a practicum where you work with a community agency. And I said, oh, okay, well, I'm going to be here for 2 years, I'll do that. And it completely changed my career. I have to tell you, I work with Senior Services of Seattle and King County around trying to do a asset and needs assessment for how to, for safe and healthy physical activity resources for older adults in diverse communities. I worked with public health leaders and experts who knew much more than I did. I learned how to respect them. I learned how to listen. And I learned how to think through the lens of somebody who would have to implement a program at scale in a community setting, not just for a research project, but beyond. It completely changed my way of thinking. It changed my commitment to community engagement and how I think about the role of a physician and a physician leader. And I think that's what we're building with our training programs. I think that's why we're growing in areas of public health and why a medical school needs to be deeply invested in training and education in these types of areas. I also say that I'm but one person, and there are other people like me here, many of you in the room, right? And so IFAM is not led by me. It's not a person. It's not about me. It's about a vision. It's about a collective of people. It's about people working together towards common vision and a set of principles. And I will say that I am just privileged to work alongside. These are the the faculty leaders of the centers in IFAM and the Vice Dean of Research, Rex Chisholm, who really kind of meet monthly to decide on the strategy and the sort of how we, what are the major initiatives of the Institute. It was in this, meeting that we sort of, people began talking and saying, we really need a center for dissemination and implementation science because, and so, there's a lot of ideas are born here, a lot of new partnerships, and I'm privileged to stand alongside these folks. It really takes a village. These are just the faculty leaders, but we decide things together and ideally in the most collaborative way we can. And I will tell you, I didn't talk about COVID today, right? I could have talked all about COVID and all the magical things that happened in our institute during the pandemic, and it really, I did that last year, and I think I'm inspired by the work that people just dropped what they were doing and rolled up their sleeves and worked with agencies and community partners and the governor's office and all sorts of entities. We don't know what tomorrow will bring. If our 10-year anniversary was 3 years ago in December of 2019, I wouldn't say, hey, when the pandemic comes in March, here's how we're going to act, right? Nobody saw it coming. I have no idea what's going to happen in March of 23. None of us do. But everything we do in the Institute, we try to center and anchor on principles. And, you know, the inspiration for this came out of those principles of community engagement, but, you know, for an institute at a school level, they also add a few additional things. And I think anything we do strategically has to be anchored to these principles, and it's the common thread that pulls us together. And it inspires all of us, and I think that is important in saying that whatever happens in the future, it will be guided by these principles. You know, I'll just say too that, you know, we have woven, right, threads into a 163-year-old tapestry, right? We're contributing to the culture of a long-lasting institution. That's a medical school, and it's Northwestern Medical School. And, you know, I think it's amazing just in 10 years how we've been able to contribute to things that are part of the lasting infrastructure. And today, community engagement, for example, is one of 5 mission pillars for the entire School of Medicine. That wasn't there 10 years ago. It is a new contribution. The culture is different, the energy is different, and the focus on public health and public health science has grown. This is everybody. These are the members and the staff of IPHAM, all represented on a page. I showed examples, I showed some pictures of people, I talked about some key programs and initiatives. But it really does take a village, and IPHAM is an idea, IPHAM is a collective, IPHAM is a coordinated and sometimes uncoordinated, but aspiring and inspiring group of people, and they're all represented here, and I'm so privileged to work with all of them. And I just want to recognize all of you today, and thank you for coming and celebrating with us our 10th anniversary.